Hey everyone! Today I'm diving into something that might seem complex, but is crucial for employers managing healthcare costs: Medicare Advantage reforms. These reforms can be a game changer for self-funded employers looking to tackle those pesky hospital markups. First up, let's talk about cutting excess plan payments. The Centers for Medicare and Medicaid Services, or CMS, is tightening risk adjustment audits and slashing coding intensity from 5.9% to a whopping 20%. This means MA plans will pay hospitals less while keeping their margins intact. And guess what? This shows that providers can actually survive on rates closer to 100 to 110% of Medicare fee-for-service, rather than the 250 to 300% they often charge employer networks. Next, let's discuss benchmark growth slowdown. Capitation rates are set to rise by only about 2% in FY 2026, down from the usual 4 to 5%. This puts a lid on the prices inside MA contracts. Employers can use this as a benchmark for their commercial contracting, instead of relying on inflated hospital chargemasters plus CPI. Now, site-neutral and out-of-network rules. The MA final rule for 2025 extends site-neutral payment pilots and limits out-of-network cost-sharing for certain PPOs. This narrows the premium hospitals charge for clinic-level services and reins in those nasty surprise bills. Employers can leverage this to pay ASC or office-equivalent rates in their PPOs and cap out-of-network claims. Public spotlight on overpayment. MedPAC and CRFB estimate a staggering $1.2 trillion in Medicare Advantage overpayments from 2025 to 2034. This creates political momentum for Medicare as benchmark pricing. Employers can align with federal reform cues, making Medicare X 1.8 caps seem fiscally responsible. So, what can self-funded plans do? They're adopting reference-based pricing at Medicare plus X%. Contracts are trending towards 140 to 180% of Medicare for inpatient, and 120 to 150% for outpatient services. They're also using benchmark-linked escalators instead of chargemaster inflation, and site-neutral carve-outs to save on imaging, drug infusions, and clinic visits. And don't forget provider scorecards using MA allowed amount data to highlight hospital markups and most favored payer clauses to ensure competitive pricing. Alright, benefits teams, here's your action checklist. Track CMS announcements each February to April, map hospital markups quarterly, and get those savings rolling. If you are a self-funded employer who is looking to save money on their healthcare spend, visit us at finhealth.com or email us at sales@finhealth.com. We save clients literally millions. We are proud of our 7.8 to 1 hard dollar ROI with a guaranteed 2 to 1 hard dollar ROI.